Imagine suddenly having severe chest pain, shortness of breath, a wave of restlessness and panic. And no one is around, no one to call for help. No ambulance in sight. Every second, every minute could be the most important moment of your life, and it all depends on you. Today, we're diving into a topic that could literally mean the difference between life and death, something most people never think about, until it happens, having a heart attack while you're completely alone. In this video, we'll teach you how to recognize the key symptoms of a heart attack and exactly what actions you need to take, quickly and correctly, to seriously increase your chance of survival. In a moment like this, every move matters, and knowing these life-saving steps can make the ultimate difference. So stick with us until the end of this video, because the information you're about to get could one day save your life, or the lives of your loved ones. 1. Recognizing heart attack symptoms. A heart attack happens when one of the coronary arteries that supply blood and oxygen to the heart muscle gets blocked. This blockage usually occurs because of a blood clot forming on fatty plaques inside the arteries. When this blockage occurs, the heart muscle quickly stops getting enough oxygen, and heart cells begin to get damaged. Identifying early symptoms on time is the first crucial step to prevent more severe damage. Chest pain is one of the most common signs of a heart attack, but it's not always present. Especially in women, the elderly, and diabetic patients, unusual symptoms like shortness of breath, nausea, or pain in the jaw and arm may appear. So, any unusual discomfort in these areas should be taken seriously and never ignored. Quickly recognizing these signs helps start treatment as soon as possible, reducing the damage to the heart muscle. Even if you're unsure, it's better to seek medical help early to prevent further complications. Remember, time is the most important factor in saving your life. 2. Immediate call to emergency services. Calling emergency services right after noticing heart attack symptoms can literally save your life. Emergency operators are trained to give you crucial guidance to help manage your condition until the ambulance arrives. Keeping the call on speakerphone lets you keep your hands free and follow the operator's instructions step by step. If you're still somewhat conscious, the operator can better assess your condition and relay accurate information to the rescue team. Driving yourself or trying to get to the hospital can be super risky because you might lose consciousness or get into an accident. It's safer to stay put at home or wherever you are and wait for the emergency team to arrive. Meanwhile, have key info ready, like your exact location and symptoms, so you can quickly and clearly share them with emergency services. 3. Proper body position. Positioning your body correctly can help improve heart function and breathing. Sitting or lying down with your head and upper body elevated reduces pressure on the heart and helps oxygen circulate better. This posture also lowers the pressure inside your chest, which is crucial during a heart attack. When you stand or bend over, your heart has to work harder to pump blood, which can make things worse. So, keeping a comfortable and steady position helps reduce physiological stress. Plus, keeping your head and chest elevated makes breathing easier, vital for delivering oxygen to your body. Using a pillow or leaning against a wall can help maintain this position and prevent falls. This minimizes the risk of injury from fainting or collapsing during severe weakness, keeping you safer overall. 4. Taking aspirin. Aspirin is an anti-inflammatory and blood-thinning medication that works by preventing platelets from clumping together, which helps reduce blood clot formation. During a heart attack, a blood clot blocks the coronary arteries, cutting off oxygen to the heart muscle. Taking aspirin can help stop these clots from growing and prevent a full artery blockage. Clinical studies have shown that quickly taking aspirin during a heart attack can lower the risk of death and limit damage to the heart muscle. That's why doctors recommend that if someone shows heart attack symptoms and isn't allergic to aspirin, they should chew one aspirin tablet immediately. However, this advice is only for emergency situations and should never be done without consulting a doctor. Some people might be allergic to aspirin or take medications that could interact, so individual conditions must always be considered. 5. Breathing control and staying calm. Stress and anxiety during a heart attack trigger the release of hormones like adrenaline, which increase heart rate and blood pressure. This can worsen your heart's condition and cause more damage to the heart muscle. That's why controlling your breathing and staying calm is super important. Deep, slow breaths help reduce the activity of your sympathetic nervous system and activate the parasympathetic system instead. This calming system slows your heart rate and keeps your blood pressure in check. Simple techniques like breathing in through your nose, holding your breath through your nose, holding your breath for a few seconds, then exhaling slowly through your mouth can effectively help with this process. Besides breathing, mindfulness techniques like focusing on a fixed point or mentally repeating soothing words can reduce stress. These methods improve your mental state, helping your body conserve energy and perform better during a crisis. 6. Avoiding extra physical activity. A heart attack means your heart muscle is already weakened, and any extra physical activity increases pressure and oxygen demand. This can worsen the damage and even lead to more severe symptoms or complications. So staying calm and avoiding unnecessary movements or effort is crucial. Excessive physical activity, especially during a heart emergency, raises heart rate and blood pressure, increasing the risk of heart failure or cardiac arrest. Even if you feel the urge to move or grab something, it's best to wait until medical help arrives. If you happen to be in a dangerous place like the bathroom or on stairs, move to a safer spot with minimal effort. This helps prevent secondary accidents like falls or injuries and keeps you as safe as possible. 7. Loosening tight clothing. Tight clothes like ties, belts, shirt collars, or bras can restrict blood flow and breathing. During a heart attack, when your body needs maximum oxygen, any restriction can increase pressure and make recovery harder. Loosening tight clothing allows your chest and abdomen to move more freely, improving breathing and blood circulation while reducing internal pressure. This simple but important step can also help lower anxiety and increase comfort. Plus, loosening clothes helps your body regulate temperature better and prevents excessive sweating, which is common during a heart attack and needs to be controlled. 8. Avoid eating or drinking. During a heart attack, your digestive system might not function properly due to reduced blood flow, and eating or drinking could increase the risk of choking. Also, if emergency surgery or anesthesia is needed, having an empty stomach is important. Nausea and vomiting are common heart attack symptoms, and consuming food or drinks can make these worse. So, it's best not to eat or drink anything until medical help arrives. The most important thing is to stay conscious and manage your symptoms. By controlling your breathing and staying calm, your body can better cope until the medical team gets there and starts proper treatment. 9. Prevention and preparing for the future. Preventing a heart attack requires lifestyle changes including a healthy diet, regular exercise, weight control, and stress management. These factors help reduce fatty plaques in the arteries and improve heart function. Regular medical checkups and monitoring risk factors like blood pressure and cholesterol play a vital role in early detection of heart problems. Being aware of these and following medical advice significantly lowers your risk of a heart attack. Besides that, keeping essential medications like aspirin or nitroglycerin handy and knowing how to use them properly is crucial to prevent your condition from worsening. Having a fully charged phone and knowing the quickest routes to the nearest hospital is also a smart move that gives you peace of mind and confidence. These tips are essential for everyone, even if you don't currently have any heart issues, because you might find yourself, or someone else, in a situation where a life is at risk, and this knowledge can help you manage the crisis properly. If you care about heart health and being ready for emergencies, we highly recommend sharing this video with others. Learning and spreading this info could literally save lives when it matters most.